Hi, I'm Dr. Mark P. Schwartz, Medical Director of Inpatient Detox Services at Penn Medicine, Princeton House Behavioral Health. I'm board certified in family medicine and addiction medicine. Today, I'm going to talk about safely withdrawing from alcohol and benzodiazepines, a class of prescription medications used to treat anxiety, seizures, and insomnia, a process sometimes referred to as detox, and more recently as withdrawal management. In 2019, the National Survey on Drug Use and Health reported that 5.6% of people over the age of 18 have an alcohol use disorder, and the number of benzodiazepine prescriptions in the United States has been increasing for the past 15 years, according to the Centers for Disease Control and Prevention. If you have concerns about medication use and aren't sure if the prescriptions that you're taking are benzodiazepines, please ask your doctor or pharmacist. When it comes to dependence on alcohol or benzodiazepines, the first step is recognizing that you have a problem. The signs of a substance use disorder include taking substances in larger quantities, wanting to cut down but being unable to, continuing to use substances despite problems, cravings, withdrawal symptoms when discontinuing. People can become dependent on alcohol or benzodiazepines, or a combination of both. Others can also be dependent on other classes of substances, including opioids, such as oxycodone, or stimulants such as cocaine. The combination of benzodiazepines and opioids can contribute to the risk of overdose. A safe withdrawal is the first step in treating alcohol or benzodiazepine dependence. Further evaluation is required to identify relapse triggers, such as anxiety disorders or depression. These may need behavioral treatment or possibly the prescription of safer, non-benzodiazepine medications. For most people who are withdrawing from alcohol or benzodiazepines, inpatient care can be the safest option because there are medical concerns that could lead to a situation requiring a rapid adjustment in treatment. An inpatient program also has the benefit of removing someone from the environment that's associated with the behavior that they are trying to change. The inpatient setting, together with group and individual therapy, can accelerate entry into recovery. During withdrawal, some people may have mild symptoms such as sweats, anxiety, and tremors. However, these symptoms can quickly shift from mild to severe, including irregular heart rate, hallucinations, and seizures, and the results could be dangerous. Because everyone reacts differently to withdrawal, patients are carefully monitored to ensure that their heart rate, blood pressure, and other vital signs remain in a safe range. Patients are also evaluated for other issues, such as nutritional deficiencies and electrolyte abnormalities, which, if left untreated, could result in an increased risk for seizures and cardiac arrhythmias. On average, inpatient withdrawal takes between 5 and 10 days of inpatient treatment. In the rare event that medical care exceeding what's available at Princeton House is necessary, the patient can easily be transferred to Princeton Medical Center. The medical center supports Princeton House patients with skilled nurses, therapists, physicians, and other related services. After a patient is discharged from inpatient care, we strongly encourage them to continue with an outpatient program, or in some cases, an inpatient rehab or residential program. Princeton House offers outpatient treatment for adolescents and adults with substance use disorders. There are also separate programs for women with a history of trauma and addiction, and for those with both psychiatric and substance use disorders. If you or a loved one need assistance with withdrawal management, admissions clinicians at Princeton House are available 24/7 for a phone consultation so we can evaluate your needs and possibly help you avoid a medical emergency. For those experiencing a medical emergency, call 911. Princeton Medical Center has a designated treatment team in the emergency department for people with behavioral health and substance use disorders. Princeton House is approved by all major health insurance companies, including Medicare, Medicaid, and government programs. If you'd like to stop drinking alcohol or stop taking benzodiazepines, don't do it alone. Remember that safe, supportive care is available.
you.